Now I'll go right across into my next interview, which is with Therapy Works, and this is a running segment on the different things dealing with those who are differently able, or those who are on the spectrum for different, what would you call it?
Disorders.
Yes, different disorders. So with me this morning, I have Sarah Stevens again, occupational therapist, and this morning I have a special guest with me, Tara Jackman, who is a clinical psychologist.
Thanks for having us here.
Yeah, thanks for being here. So this morning we are going to speak a little bit about the mind and speak about team evaluations.
Correct.
So tell me, Tara, why would a child need psychoeducational evaluation?
So a kid would need a psychoeducational evaluation if there's a concern by their parents or school in terms of difficulties with learning, attention, mood, behavior. So any child that's having any of those challenges in those areas, a psychoeducational eval would give a better understanding of what's going on and steer treatment.
And Sarah, what's a team evaluation?
So a team evaluation, it grew out of the need that we saw from families. So children they'd identify a problem going on in school, they'd be struggling with learning, and they would be referred on to an educational psychologist or clinical psychologist. And so we were getting a lot of referrals from Tara. Tara would assess them, see that they have certain needs, and then say, I want them to go further and get an occupational therapy eval or a speech eval or both. What we realized was when that happened, the parents had to get the psychoed eval scheduled, and then they had to call us and wait to get the OT and the speech eval scheduled. And as you can imagine, it adds up time-wise off of work, cost for the evaluations, for all the professionals' time. And then it took us time because we'd want to then communicate between all of us to try and see how can we best serve this family. So the team evaluation we started about 6 months ago, I'd say.
Yeah.
And the kids come to us, and Tara comes to our office, and in a morning session, they go through all three professionals. What's great about it is they meet with the psychologist, they meet with the occupational therapist, and the speech therapist. Then we send the families home. We quick eat a lunch, score all our tests, and then we sit down and we put three brains together to decide how can we best serve this child. We look and say, well, I saw that he struggled with this, but he was really quite strong in this area. And then what's nice is we've seen Tara say, I'm seeing some concerns with language, and then Robin pops in and says, yes, those are the similar scores that I got. And from there, we're really able to put together a whole complete understanding of what this child's needs are. We meet with the parents about a week later, and we present what our findings are, and then we present a plan forward, which is nice.
It sounds like that makes it very convenient and easy. Do you have any idea how it was done before?
Well, I mean, since I have been here since.
Well, in terms of when we look at Trinidad, there are not a lot of people in terms of taking that multidisciplinary approach.
Right.
So you have the psychology, the occupational therapy, the speech therapy, but this model has been done in other countries, so the States, the UK, Canada. But we're probably one of the few. I think there's one other place that does it. So for us, it's really just making it convenient for parents, and then also too, they're getting, a team of 3 people looking at their kid, right? So you get a lot more information, insights.
I'm guessing before they would have gone to see a psychologist, and then they would have been sent to go see an OT, and then sent to see a speech language pathologist, and just bouncing all over the country, because many times the offices are in different areas, right? Yeah. So what you are doing now just seems like it's so much more convenient.
And I think, too, like what I would see as a single therapist, when I have the input from the other team, I'm able to see the bigger picture. So I might be looking at one specific area, but when I have their input and like, when they have my input.
It's a really nice
approach.
And then you also have the support of other professionals. Right.
So who needs to refer a child to get this sort of evaluation?
Well, typically, it would be schools. So if a teacher has a concern, then they would air that concern to the principal, and the principal would reach out to professionals.
Okay.
But it could be, parents reaching out to the psychologists themselves. Then also pediatricians, neurologists, anybody working with kids.
Anyone working with kids.
Yeah.
Okay. All right, and one more question before we go. Sarah, what type of children are appropriate for this type of evaluation?
Right now we're seeing children ages 2 to about 7, so preschoolers, and then children in the first 2 years of primary school are like standard 1. And that's kind of the range that we're seeing.
Right. All right. Well,
Yeah.
Tara, I like saying that as it rhymes.
Thanks for
Thank
having
you so
us.
much for
Yeah.
joining us this morning and sharing. And of course, people can contact Therapy Works
Yes.
to get further information on how their child or their loved one could be helped.
Yes, exactly.
All right,
Thanks,
so
Carrie.
thanks again, and thanks. And as we said, this is a regular segment here on Now. And so on Mondays, we have this segment called Therapy Works, where we touch on the different areas of therapy that could be available for your child or your loved one.